Welcome back, everyone. Doug LaRue is with us today. He's from Lima Memorial Health System. He's the EMS manager there. We're talking a little bit about CPR and what you need to know. Let's talk first. We're talking about, a patient or a victim that has cardiac arrest. Give us a sense of what that is, maybe what we need to look for to know that's going on with that person.
Okay, well, thanks for having me this morning, Jeff. This is actually something we all should be aware of, and we can ultimately save a patient's life, whether it be a family member, whether it be a friend, or, just somebody general in the community that collapses. A cardiac arrest can either be abrupt, which means they go into cardiac arrest immediately, or they have some signs and symptoms that actually precipitate that cardiac arrest. Those include shortness of breath. You can have neck, jaw, or shoulder pain, a lot of back pain. You can have nausea, or you can have pain going down one arm or the other. If you have any of those signs and symptoms, you want to call 911.
It's interesting because I think most of us would say we're just not prepared or not qualified to help out in that situation when it comes to CPR. But as you mentioned, there are things we can do to save a life. Walk us through that process, what we should do.
Absolutely. The first thing is just being aware, that somebody is experiencing a cardiac arrest. If somebody's not responding and they're not breathing, the biggest thing that you can do are two steps. One's activating 911. The other thing is doing effective chest compressions. What you're going to do is put your hand in the center of the chest and go down 2 to 2.5 inches. If you think of the song Staying Alive, that's kind of the beat that you want to be doing your chest compressions on. That beat is 100 to 120 beats per minute. And like I said, don't stop doing those chest compressions until your EMS agency arrives. It can take over. The other part to that is having an AED. That's actually going to restore a patient's heart rhythm back to a normal rhythm, hopefully, and will increase the patient's chance of survival.
Doug, I think back, and I'm sure when you were a kid too, we always also at the same time were taught, okay, do the chest compressions and then mouth to mouth. But mouth to mouth's kind of been ruled out, and we focus more on those chest compressions, don't we?
Absolutely. And the reason being is, if you think of an engine, that's kind of the analogy I use. And an engine needs the oil and the fuel to keep it functioning. The heart's very similar. It needs that blood flowing to keep the heart and vital organs, alive long enough for them to be defibrillated, the heart to be defibrillated and put back into a normal rhythm. That easy step of doing those chest compressions until EMS arrives is critically important and very easy to do. You won't get tired, trust me, because you're going to have a lot of adrenaline going when that happens. And like I said, it's usually a loved one that we're talking about. Just to cover some of the statistics, 395,000 people a year suffer out of hospital cardiac arrest. Of those, 80% occur actually at home, where you have a family member, a friend, or a bystander that could do that easy step of doing chest compressions to keep those vital organs supplied with the blood that they need in order to flow.
You mentioned too, Doug, the key is, before we begin this, is to call 911, and then we're, in a sense, the transition while the professionals are on the way.
Absolutely. We've came so far with EMS, and the treatment that they give to our patients pre-hospital. For instance, doing those chest compressions till EMS arrives, they'll actually have a cardiac monitor, hook up the AED pads, which is an automatic external defibrillator that's actually going to deliver the shock to the patient. And there's also medications. We can actually take a picture with an EKG machine now and send it to the hospital, pre-hospital, before an EMS ambulance arrives to our emergency center. The goal of that is, once they get that EKG, they can tell if a patient needs to go directly to our heart cath lab, which will open that vessel up and, restore blood flow to the heart. So it's very important that you call 911 to get an EMS agency en route. But just remember, do not stop doing chest compressions until that EMS agency arrives.
All right, great information, life-saving information. Doug, thank you so much. We appreciate it.
Thank you. Have a good day.
You too. Nice chatting with you. We'll be back after this.